Nigeria has registered more than 1,000 suspected cases of the monkeypox disease, according to the country's Center for Disease Control. The West African nation is currently the leading nation with the highest number of infection and deaths, with 6 out of the 12 deaths in the continent. The country's healthcare personnel say they are widening their surveillance initiative while urging the government to improve public awareness. Here's more details of that in this report.
Phillips Udo is a medical doctor at this hospital in Jos. He says the growing population is among the factors behind the spread of monkeypox infections in Nigeria.
Epidemiologically speaking, when you talk about who is leading what, you need to look at the underlying denominator. Nigeria is a large country. We have hundreds of millions of people. And so you need to compare our number with our general population when you're comparing with other countries. And so comparing us with Tanzania, for instance, isn't fair because Tanzania have less persons than in Nigeria.
I don't know about the surveillance systems in other countries of Africa, but in Nigeria we have a very good surveillance system. And so no case really of monkeypox will go undetected. Down from the local government up to the state and to the national level, the surveillance is good.
Nigeria's Center for Disease Control, the NCDC, says the country has recorded more than 1,000 suspected cases of the disease since the outbreak in 2017, and about 400 have been confirmed. The World Health Organization says Nigeria has recorded 6 of 12 deaths caused by the disease on the African continent between January and August this year. Monkeypox disease is caused by a virus similar to that which causes smallpox and can be spread through skin-to-skin contact. People can also be infected from a touch or from a bite by animals such as rats or monkeys. Public health personnel in Nigeria say they are adhering to universal precautions on infectious diseases in handling suspected monkeypox cases in the country.
Staff of the hospital are placed on high alert, so that they have a high index of suspicion for anything that looks like monkeypox. And in the event that they get a suspected case, such a person is properly isolated to avoid spread to other patients and people in the community. And also, the patients are managed conservatively with samples taken. And those samples are treated as very highly infectious, and they are taken to the labs for confirmation.
Health experts are urging the government to increase awareness among citizens on how to prevent the spread of the disease. Health authorities in the country say they are strengthening surveillance at national and subnational levels to increase awareness and to promptly detect and respond to the outbreak. They are also warning citizens against eating inadequately cooked meat of animals, especially those identified to be carriers of the monkeypox disease. The government believes these measures will lead to a reduction in monkeypox cases in the country and subsequently lead it to becoming monkeypox-free someday.